This podcast is about sex and Parkinson's, and it's intended for mature audiences. Viewer discretion is advised.
I am really excited. So we have Dr. Samantha Evans on with us today. And just for a quick little bit of background, a lot of my young onset friends have always talked about you and Dr. Mishley in Seattle and all the things that you guys do for Parkinson's, all the research that you've done. So I'm super excited to dive in. And like I said, Brian's going to be excited too. Welcome to The Secret Life of Parkinson's, a podcast created by people living with Parkinson's to help break the stigma of a disease no one likes to talk about. Now here are your hosts, Jessica Krauser and Brian Baker. Let's actually first, let's have Dr. Evans introduce herself and just give us a little bit of background about what you've studied, what you do, and then we'll go to the topic from there.
Yeah, great. So I'm Dr. Samantha Evans. I'm a naturopathic doctor. My specialty, I work with people with Parkinson's disease. I've done a residency under Dr. Mishley. I've helped with some of the research with that she does, the MVP study with Parkinson's disease. And my specialty that I'm very passionate about is pretty much anything below the waist. So, and microbiome, I've been working with since residency, and I'm really passionate about that. And then as of the past couple of years, and new research is coming out hopefully soon, it's sexual health in Parkinson's. It's a completely under-discussed topic, and I'm very passionate about it. So
that's what we're talking about today, Brian. We're talking about sex and Parkinson's.
Baby.
You and me.
I don't know anything about sex. So.
Every time I give a talk, I always start with that song.
I mean, how can you not? Like every time I say it, like it just comes. Okay, so I don't even know where to start with that. So how do you what do you talk about? Like how do you kick things off? Or I guess maybe what questions do people usually ask you? I don't know.
Yeah, I think one of the big things is it's not talked about, right? And so when you go in with your neurologist, a lot of it's like medication dosing, like where are you at? And but interestingly, it is studied. But if you think about it, it's such a taboo topic.
Yeah.
Right. And like I said, I work from the waist down. So telling people, even when I ask my patients about constipation, they're like, I'm talking about poop, let alone talking about like your sex life. Like, can you get an erection?
Mm-hmm.
Like, are you having an orgasm? Like if they're about their poop, like talking about that is just a whole other playing field.
Yeah.
So having doctors, the education is not really there unless you're in that field. So we know, actually, there's been studies on this. People with Parkinson's disease are more likely to have sexual dysfunction than people without. So there is that. And from a timing standpoint, like asking you about like, hey, how's your interest in sex? Are you having a hard time having an orgasm? Do you have a low libido? Are you having difficulty getting an erection, maintaining erection? Like all of that. Mm-hmm. That is even when I ask my patients about that, I'm like, that's a whole visit. Like, let's have an entire visit about that. And because it really is an entire visit.
So what do you do for them? Or like, how do you help? Do you like, I don't know.
I know.
You have training classes?
Yeah. So I actually got extra training in it. So it depends. So if you think about it, let's take like Parkinson's out of it. Mm-hmm. If you think about where things go awry in the bedroom, there's so many different ways that it can, right?
Yeah.
One, like
losing your rhythm.
Position.
Losing your what?
Losing your rhythm.
Oh.
Right.
I didn't have any rhythm beforehand.
Oh, this is going to be so weird. Okay, keep going. Go ahead.
It's gonna be great. So, like, one of the things is, like, what worked before doesn't work, right? As you get older, like we're like, oh yeah, like we're going to have sex the same way we used to in our 20s. Well, guess what? You're not 20 anymore. You're just not. And then you're going to lay there and be like, no, that doesn't like, I don't like that. But you're not going to tell the person you're having sex with that you don't like that. Well, they can't read your mind. Right. And so this is where a lot of communication difficulties end up happening is like you expect the person to read your mind and they can't. So one of the first things I actually talk to people about is like, are you talking to each other? Like, are you having a conversation about like, hey, like I am not having an orgasm. Like, you know, I'm not getting to my peak yet, like, because this doesn't feel great. Like, you know, I'm thinking about the dishes. I'm thinking about all the stuff that I have to do. Like, I'm not getting an erection because I'm not doing that. Or like, yep, not getting there, honey. Like, that's just because you're thinking about other things or they're not hitting the right spot. And then you bring Parkinson's into the mix and like, is your med, are you on? Like, are you having dyskinesias? Are you like, where are you at in your med dosing? Right. And so this is where tools come into play too.
So like, happy Valentine's Day.
I know. Yay. This is the perfect time to have me talk.
It actually is. We're gonna
Day.
post this next week, which is Valentine's Day.
I can't wait.
I know. Actually, FYI, if my parents or in-laws are watching, maybe just turn it off. Like, set it aside.
Or maybe this will be exciting for them to watch too. Yeah.
That's what I was saying. Like, no. So throwing Parkinson's in the mix, is it like, because I know like constipation is a huge issue, you know, for many reasons of terms of like how Parkinson's like slows down our system or how it like, you know, tightens or restricts like certain like muscle groups. So is that like playing into it as well? Or is it more just because of the medications and stuff like that?
No, it's all of it. So it's honestly everything. So you add constipation and then urinary incontinence or frequency or urgency. You add that, and then you can add rigidity and like no one wants to have sex if they're constipated.
Yeah.
No one does. Like sitting there feeling bloated, like, no, don't touch me. Like, no way. And so, because that's what you're thinking about when you're laying there, right? Or like, I'm not going to feel comfortable. So part of it is Parkinson's, like a mobility piece from an act standpoint, right? Like just the act piece. And then there's the interest piece where like dopamine comes with like interest. And actually that leads to a whole other situation of dopamine agonists. So dopamine agonists, the opposite can happen.
Yeah.
So you can be hypersexual and it's like, if your partner isn't in that same boat, you're screwed.
Yeah.
It's like, that's pun intended.
My husband was actually, it was funny because I was on a dopamine agonist first, and that's one of the first things the doctor said is like, you can be addicted to gambling, sex, or shopping. And he's like, ooh. And then we came back the next time and he's like, no.
Darn it.
Didn't happen. But that is, that is interesting.
Yeah.
Were you going to say something?
No, I'm just.
You're just taking it all in.
No, I'm just.
Yeah.
So what do you advise your clients or patients? Like, what do you do?
Yeah. So honestly, so one of the first things again is to talk to each other. That's a big thing is like, are you having that conversation? The other thing is time your meds and like plan sex, which honestly, a lot of people are like, I don't want to plan sex. I want it to be spontaneous. I'm like, well, you kind of got to plan it.
Yeah.
Plan it a little bit, like set it on the calendar. I'm going to take my meds at this time. Some people need to take an extra, like, think about like Viagra. Like if I have to take Viagra because so I can get an erection, I got to wait 30 minutes for it to kick in. Right. But think about that like your PD meds. Some people are like, okay, I'm going to have sex. Like, I need to make sure I'm not off. I'm going to take an extra emergency dose of meds so that I can be on.
Yeah.
See, I would think that'd be opposite. I would think you would need less meds because you're going to get a little bit of natural. I mean, at least me, I'm going to get a little natural high off of, hey, I'm going to score.
Yeah, but I mean, but if your body is rigid, you know.
I mean, hey, I didn't say it was going to be good. I just said it was
Depends on who's doing all the work.
No, but I've gone out, I had to be like, listen, I have Parkinson's. Like, what's that mean? And I know that's what they mean. Like, what's that mean? Section? Like, nothing. It just means I don't have any rhythm, and I might be a little bit stiff.
Oh, when you were single?
Yeah.
How do you have do you have like single people that come in and have this discussion?
Mm-hmm. Yeah. And I think one of the things is some people are like, I don't care, like, or not being interested in sex is a non-issue for me.
Mm-hmm.
But I do have quite a few people who are single and are like, I'm going to get back in the dating game. What do I do? And I'm like, the question is not so much about the interest in sex or active sex or anything like that. It's more of a, when do I tell this person that I'm dating or about to date that I have Parkinson's? And that is like a whole different conversation of like, that's a comfort, that's an individual, that's like more of a
personal.
Some people are like day one.
Yeah, that's what I am.
You said it up front.
Oh yeah, well, because they think you're drunk sometimes. You're like,
Yeah.
Or you're having problems cutting something, and they're like, what's wrong with it? So I just cut right to the chase. This is the deal.
Yeah.
Yeah. And then actually we're sitting on some data that you guys are going to be the first to know about.
Yay.
Yeah. So I'm hoping this gets published soon, but you guys are going to be the first to hear about it. I was working on it yesterday. The research hasn't been done on like the difference between men and women, like in Parkinson's. Honestly, women in Parkinson's just haven't been researched all that much. And I have really strong passion about it. And we used the MVP study to see like women, like if you have people who say they have no interest in sex, what symptoms, like what are their symptoms? And what symptoms are worse? What people who say they have a strong interest, what symptoms are worse? What symptoms are better? But the thing that stuck out the most for me was we have something called like a normal distribution. Men, it basically looks like this, like, it was pretty equal. There's a strong, like men are who it's equal between a really strong and a really like not interested at all. There's 4 in between, but women are like not interested in sex. The women with Parkinson's have no interest in sex. It was a very strong number compared to men. I can't tell you the exact numbers, but it was really high compared to men.
That's why I don't date a woman with Parkinson's.
That's why what?
That's why I won't date a woman with Parkinson's.
So
it was fascinating.
So it's across the board? Like, doesn't matter age, doesn't matter,
it corrected for age. It was, the average age was 66, I believe. And pretty equal men and women. And this was like 800 people in the study. And so I was like, what? Oh my God, this is huge. But this takes into the consideration, like, okay, average 66, what is the difference? And I'm also I'm reading all this stuff on menopause. Like, I'm like, what is it about? Is it menopause? Is it not just Parkinson's? Are we forgetting menopause is a whole piece of this too? Like the drop in estrogen, drop in testosterone, drop in progesterone. Like, guess what? That's a piece too that we need to not forget about.
Right.
And would this get better if we corrected that?
Did you account for how long it had Parkinson's? Because I mean, early on, it, consumed for like the first year or so. You're right. Sex, nothing goes on my mind other than, I have a stupid disease. But as you start to live your life a little bit longer,
Get comfortable.
yeah.
Yeah, it did correct that. But that's also something that I've talked to my patients about too, of like some people it's not on their mind at all because it is so raw and such a new diagnosis that they're like, what am I like if I'm laying there or I don't want to have sex, all I can think about is Parkinson's,
Yeah.
right? The other thing to keep in mind is meds that a lot of times people are put on that are not even Parkinson's related. As you get older, you're on more medication that actually can cause erectile dysfunction, decreased libido, so that's something to keep in mind too. So there's a lot of factors. It's not just like the physical component to sex and libido and orgasm. Like there's actually, it's so multifactorial. And I think one thing that I tell my patients is once you get diagnosed with Parkinson's, it's like, oh, I have this symptoms. It's Parkinson's. It's gotta be. And I'm like, well, it could be like, oh, I fell over this rock. I'm like, it's Parkinson's. I'm like, or it's a giant rock. Like
we attribute everything to it.
Yeah.
We have that problem.
Yeah, and I get it.
But going back to what you found out about like the women, like what do you know anything more as to like why or what can we do about it?
No,
Well,
this is the first study of its kind.
Oh.
If you figure that out, you've unlocked the mystery between men and women. I mean, guys think about sex nonstop all the time.
Yeah, but if this isn't, I mean, this is in is this in comparison to people without Parkinson's?
Nope, this is just people with Parkinson's.
Oh, okay.
I didn't compare it to people
guys
without
with
Parkinson's.
still think about sex.
What?
I said, it just goes to show even guys with Parkinson's still think about sex.
Well, I was just wondering, like, if with women that don't have Parkinson's, like, is it an age related thing of like, if they're have interest or not? I don't know.
Yeah.
Are you working with Rochelle Flanagan by any chance?
The nutritionist in
Ireland?
Ireland?
Yeah.
Mm-mm.
Okay.
No, but she's amazing.
I know she was doing, we talked to her a year or two ago, I think, but that she was doing like a lot of stuff with women's health and understanding the whole cycle as well. But yeah.
I know that there's a paper, like I've looked at some of the research on estrogen, and like there's this one paper that I looked at a while ago that like women who are taking estrogen early in the diagnosis had less symptoms, and like the role of hormones is just such I'm curious to see where that's going to. I'm curious. That's my next question.
Have you seen, I can't remember who came out with it. Was it the Parkinson's Foundation that had like a couples kit or like a sex kit?
Yes. Yeah.
Was it PD Foundation? Okay.
Yeah. I think it was the APDA.
Oh, APDA. Okay.
Yeah. The ParkinSex kit.
ParkinSex.
It's amazing.
Really? What was in it? I'm
excited about it. Yes. There's like a feather. There's a candle. There's like a book that's like tells you all about like these, I think, massages. And they were giving it out for free. So you just needed to like sign up and you'd get it. I was like, how are you giving this out for free? I was like telling all my patients to go and get it. Cause originally I was just telling them like, go get a feather, like go telling them to go buy these things, but they were actually just going out and getting it themselves.
Yeah.
So they could get it for free.
Huh.
So I'm very excited, but I don't know if it's still around, but it was available.
I know. Was it like last year or something?
Mm-hmm. Yeah, it was last year.
It was probably for Valentine's Day.
For Valentine's Day. I think they're coming up with cards now too. I think they're going to come up with like a card game or something like that. I don't know if that's out. Don't quote me on that.
Dice.
That would do it. I think that's the other thing too, is like there's so many tools out there as well that's also underutilized. And whether it's because it's taboo as well. like
Tools?
toys, like it's
toys or tools?
The toys are tools.
Okay.
So like vibrators, like if you have decreased dexterity, like a vibrator is a great tool for you, right? Like that's wonderful. Or like a cock ring is a great tool for you.
I can't stop thinking about like that when you said in the beginning, like when people just talk about poop and we're like, I'm like, I mean,
this is a very serious topic.
This is like,
I
can't
know.
tell. You guys are so uncomfortable having this conversation. I'm like, let's talk about cock rings. Let's talk about vibrators.
It's totally fine. This is going to be a new one for all of our listeners. But honestly, people have asked, you know, and I know some people probably don't want to ask because it's uncomfortable. And we've been trying to figure out like, how do we bring this up? Because it's like, I don't want to talk about myself. You don't want to talk about yourself. So, and like the biggest piece is it's like, okay, what are people struggling with? And then what can we do to help? Yeah.
Like there's online stores for that too. So I think sometimes people are like, who am I going to encounter when I'm in those stores? Like, I think people have like this weird idea of the type of people they're going to see. And you'd be surprised. That's just not who you see. And like, but if you're that afraid, you can go online and buy these things online. And honestly, also like lubricants are really helpful too, like using lube. Which you can also buy online on those stores. But so like what to do about it. So one thing with like erectile dysfunction is a lot of times we call it centralized. So it's because of the brain versus like a blood flow issue, which we can see in like diabetes or certain cardiovascular diseases where we really want to like emphasize like opening up blood flow. So I do a lot of diagrams, so me just talking is difficult. But so in order, just from a background perspective, in order for blood to go to the penis, muscles relax to allow the penis to become erect, and blood goes through, right, to make the penis erect. And that's how a cock ring works. So people use cock rings to actually make sure blood stays in the penis. So that's one of the ways that my patients will make sure that they continue to have an erection. So like, my libido's there, it's fine, but my penis can't stay erect. So that's one of the ways that my patients will use a cock ring. Some of my patients have done like at home ones. I don't recommend those because if you make them too tight and they don't loosen up, you might end up in the emergency room. So don't do that.
That's like a TV show. Did you ever see that?
Yeah.
Sex Brought Me to the ER or something like that.
I have not seen that, but I feel like that.
I mean, it's I can't remember what it's called, but it's definitely a thing.
Yeah.
So definitely want to be careful and buy stuff online. And like you said, so this came out. So I'm looking at the APDA. I don't know why. You're right. They did come out with a card game to uncover barriers.
Yeah.
And the thing that's going to be, that a lot of people probably struggle with, I think, to your point in the beginning, is just communication. Like, feeling open enough to talk about any of this, and the fact that like, if you're the individual with Parkinson's, of saying like, okay, there's things I know that I can or can't do, or I'm not comfortable doing anymore. And then on top of that, having to have that conversation to be like, it's not you, it's me. But in all honesty, it is, shut up. But then, or on the flip side, if it's the caregiver, the spouse, whatever, the partner, that doesn't have Parkinson's, if they're the ones that want to bring it up, like how do they appropriately bring it up, so as to not make the person feel bad.
And taking ego out of it. I think that's one of the biggest, like the ego piece is huge. This is one of the reasons I like I think they have this in the ParkinSex book, the first one that they have. I haven't looked at the cards, but this is where a sensual touch can come into play. It opens up lines of communication. So it's the idea of touching without it resulting in sex. So one way of doing this is like one person is giving another person a massage, and the job of the person giving the massage is to just do a massage. And the person receiving it, their job is to only tell the person giving the massage, like, can you move here? Can you move here? Like, oh, harder pressure, deeper pressure, because that opens up those lines of communication. And the person receiving that feedback take the ego out of it. Like, they just want you to move around, right? So that opens up like those lines of communication with the hope of it translating into the bedroom.
Yeah.
So I've seen that be helpful for some people. And this is also where like sex therapy can come into play too. And honestly, just therapy in general is always nice. Because this is loaded, and there's the idea of too much togetherness, especially in I don't know if you guys have heard that concept of too much togetherness with the caretaker and or partner, or caretaker and person with Parkinson's. Like you need a life outside of being like the person taking care of the person with Parkinson's and the person with Parkinson's. Like there's going to be no relationship if that's your dynamic. So the interest in having sex is just not going to be there because the roles are established. So like you need to wear your like caregiver hat and then take that off. And there needs to be time away from that. Otherwise, like the dynamic is completely different. So having your lives outside of that and away from each other, it's like absence makes the heart grow fonder is important. Even more so in this community.
Take your caregiver hat on and put a nurse's cap on.
Right, exactly. Put a different kind of hat on. Take out some cuffs.
So what questions do you have?
Nothing. I'm good.
What?
I'm just giving it all away.
No, it's great. What are there other questions that people usually ask you that we're not thinking of, that like our listeners might be asking?
I think when they come to me, a lot of times people are asking like what alternative therapies there are. And there are like a bunch of herbs out there, like yohimbine is one that can be helpful for in at least libido. So I think one of the concerns that I have with herbs is always like be mindful of sourcing because you can get a ton of it or you can get none. And so you just have to be mindful of that. The other thing is, so kind of going back to the erectile dysfunction component to it, there's, like I said, there's like not great research
I think you're starting to blame all the guys on this now.
We don't have...
Well, we have more research on men. So just to be clear, like I talk a bit about research, we have more research on men's sexual health than we do on women, because women are like a phenomenon. Like when there's like a lack of interest or difficulty with arousal and orgasm, some of it's like, what's for dinner? What am I going to make for dinner? Like, what's like our brain, and this we kind of understand, our brain, everything has to be just so. Everything has to it has to be the perfect scenario. Everything has to be teed up just perfectly for the interest and the to be there. Right. And you don't have to confirm this, Jessica, but it's true. Like if you have kids, if you have grandkids, if you're like everything has to be just so. And some men that I work with say the same thing. They're like, I'm thinking about all these other things. Or you're like thinking about like, are they interested in having sex? Like, do they actually want to have sex? Are they enjoying themselves? And so women's brains are like really complex in that. Men's are too, but a lot of times I hear from women like I need everything to be perfect. It has to be the perfect scenario. And most women do not get orgasm from penetration. So that is a misconception fun fact, like, and it takes time. Like, you gotta warm up the car before you just go for it, right? Like, just in general, you gotta warm it up.
I think that
Get her out of her head. Okay, like, you gotta get her in the moment, out of her head. And so, like, warm up that car. And this is also where cock rings come into play too.
Yeah, because I'm done by the time the car warms up.
So focus on the other individual before you like.
you have to focus on somebody
before
else.
You start. Yes. That's actually one thing that people are like, what? I'm like, yes, it takes women a lot longer. And it's true.
What do you have to say?
No, because it would be possible where the men have trouble having an orgasm based on the medication that they're on too.
Yeah.
Does the medication hinder anything like the stuff that we're on?
No. Okay. No. If anything, I've seen it help. I haven't seen much research showing that it hinders it honestly at all. There's weirdly apomorphine, which isn't prescribed much in Parkinson's anymore, but it's used to treat erectile dysfunction. But it's a PD medication.
Yeah. It's old. Is it old?
What's that?
Is it an old medicine?
It's an old medication. The dosing is way different.
Yeah.
But it's used to treat erectile dysfunction. And I'm like, so I wonder if we started using that more, or like how we could go about using it in different ways. But this is, again, to your point, like sometimes it takes men longer than women, and that communication is important, right? Like, hey, I'm not someone who you need to warm up the car, or like, hey, I am someone you need to warm up the car, or I can get an orgasm through penetration. Or, you know what, I have erectile dysfunction, or, hey, let me get out my cock ring so I can keep my penis erect. Or medication wise, like I need to take Viagra, Cialis, I need to use injections, I need to make sure my penis is erect. So, which leads to the treatments for erectile dysfunction. When I tell you there are so many. I cannot, if there is a way to get you an erection, we would figure it out, and we have. There is, first, most of the time we start with Viagra. I can tell you that's like a hit or miss with people with Parkinson's, but they always generally start with Viagra. One thing that I've seen a lot of urologists do is give something called daily dose Cialis, which is a low dose. Higher doses is given for an enlarged prostate, but lower doses you can take daily as it just makes you more like almost there. Like you're not going to have like a STEMI all day, but like you're going to be like, oh, I can get there quicker if I take this every single day. And there's actually some interesting research saying that it's cardioprotective. So you could do that daily. And that's helpful. And then Viagra, I think I've seen one study that you can use. Now, this is one study. It's not FDA approved. You have to talk to a doc about this. But like if you use morning low dose daily Cialis, if you still need help when you're going to have an erection, if you need help with getting an erection, you can still use the Viagra, but that's something that like you have to coordinate with your doc. If that doesn't work, there's also injections as well into the penis, which everyone freaks out about, but there's a but with this. It works so well. And when I say so well, like if you have like people with spinal cord injuries Like this works in neurological. If the reason for the erectile dysfunction is due to a neurological versus something to do with blood flow, injections are like, the guys that I have that are using it are like, give me the needle, give it to me. I need my penis to be erect now. And it works.
You have to.
It's shocking.
How does it work though? You get the shot. You take the shot before you need it, or you take it.
Yeah.
So you have to give yourself the shot.
You need it.
Ooh.
And it works very quick. Versus Viagra, which takes time.
You look really scared.
Yeah.
It can be like a moment of connection with your partner. You're like, no, thank you.
Beam me up, Scotty.
You mind give me a shot in my wiener?
That's really interesting. What is it called something? Is it like a...
There's a bunch of different...
Oh, there are? Okay.
There's a bunch of different ones, but yeah.
So my last question I have, is there, just like how exercise is important to help slow the progression, socializing is also really critical just for our overall like mental state. With the study that you guys did, is there anything that would suggest or say like a healthy sex life?
This is...
What?
A study came out not too long after I was diagnosed that said sex is really good for people with Parkinson's. My theory on that is because it can be a cardiovascular workout, plus it brings up your natural
dopamine.
Mm-hmm. Yeah.
Yeah.
There you go. You answered the question. Nothing in this study is doing it because it was observational. So like we didn't look at that, but I don't doubt it. I mean, and you just said that. Yeah. So sex is an important part of life. Mm-hmm. And it's a way we connect with people. There is the research saying that loneliness is the number one indicator of progression of Parkinson's. Mm-hmm. So like, if this is a way that we can connect with a human, like we need that.
Yeah.
Right.
Thanks, Dr. Baker. You
I remember because I put it out on my social media. I was like, it's for medical purposes, folks, ladies or something.
It is cardiovascular. Like, think about a workout. It is a workout. Wear your Oura ring. Wear your Oura ring or your Fitbit when you're having sex. Like, and change it up.
Never thought about that.
This position.
200 steps, baby. 200 steps.
Right? Change your position. See, like, okay, is my heart rate at the 80% my maximum? Nope, it's not. Okay, we got to change this up. What am I going to do to get my heart rate higher?
Oh, my God. We got to have you on again. Well, actually,
we can talk about poop next time.
They, you know what? We actually have not talked about that. I mean, we briefly brush over constipation, but again, it's definitely something that we need to talk about. So, let's talk about poop next time.
There's no song to go with
I know.
that.
I was just thinking, I'm like, it doesn't work.
And I do want to just say, like, there are definitely labs even with Parkinson's, like there are labs that you should get done that could potentially help, like, determine possible roots that aren't PD related. Like hormone deficiencies, that has been studied. Hormone deficiencies could be a culprit of one of the reasons of like difficulty getting an erection, maintaining erection, decreased libido, having arousal or having orgasm. There are certain like hormones, but also vitamins that like B12, vitamin D, testosterone, estrogen, DHEA, all of those, if you're deficient in those, it can make it harder. Unintended.
I picked it up.
I mean, you would probably be best friends because he loves saying stuff like that. Like all of a sudden he'll be like, oh yeah, that's what she said. Or
Yeah.
Well,
sounds like it.
Dr. Evans, thank you so much for coming on. Really, really appreciate it. And I was actually from one of our listeners that sent me an email and connected us. So thank you so much to
Yeah.
him. And so if anybody has any questions, I'm sure there will be comments. If there's enough, we might have to have her on again. But again, thank you so much. And I will leave everybody with this in our last 30 seconds. Actually, when you're going to see this, it will be on Valentine's Day. So happy Valentine's Day. For a great topic that is really important. Is just something that we don't like to talk about as a society with sexual health, but it is important. I think the biggest takeaway here is communicate. We talk about that all the time. Don't be afraid to try new things. Don't be afraid to talk to your doctor about it. And obviously, don't be afraid to talk to your partner about different things that may or may not be working. So with that, everybody have a great Valentine's Day, and we'll see you next time.